In today's episode, we're going to be discussing rotator cuff impingement syndrome, most notably at the supraspinatus. So from a side view here, you can see how the supraspinatus tendon attaches right here where it says C2, and right above it, you've got a bursa sac. And the reason that we have a bursa is that we want to protect between the bone and the tendon, so that doesn't rub and then prematurely wear down the tendon. So what happens is whenever this gets pinched under here, this bursa fills up with fluid and then it swells. That's why I have this tubing here to represent a bursa when it's actually fully opened and swollen. You can see how it makes less space underneath this area between the acromion bone on the top and the humerus down below. Think of an Oreo cookie. Your injury happens at the white creamy layer in the center. The roof is your acromion bone from the scapula, and the bottom cookie is your humerus. And then the cream is your supraspinatus tendon and the subacromial bursa. 80% of rotator cuff injuries and tears occur at the supraspinatus tendon. The supraspinatus is involved with initial rotation of that head of the humerus when we raise our arm up. With the shoulder, you have an inner layer and outer layer of muscle. If you think of wearing two t-shirts, the outer layer is going to be your deltoid muscle. That's like the bigger round muscle that you see typically on people. That's the outer layer of the t-shirt, and the inner layer is going to be that supraspinatus and the whole rotator cuff assembly. There's 4 muscles that make up the rotator cuff. So whenever the supraspinatus muscle is damaged, this outer layer of the deltoid elevates the arm, but the deltoid is actually a poor rotator. It's a good elevator, but it's a poor rotator. The rotation occurs from your rotator cuff assembly, most notably with the supraspinatus right here on the top. When you're going to bring your arm out to the side, the initial rotation of the head of the humerus occurs because this supraspinatus muscle starts that rotation, and then it allows a better glide inside that joint, and then elevates and allows the shoulder to rotate inside that socket easier and not pinch underneath this roof here of the acromion bone. Another commonly associated injury for the rotator cuff comes from the infraspinatus. Earlier we discussed the supraspinatus on top. The infraspinatus is responsible for shoulder external rotation. So as you see, Vesalius here is going to rotate the shoulder externally. It attaches here to C3. All of this is infraspinatus. So it's actually a bigger and thicker muscle than up top in the supraspinatus. So there's less instance of this one getting injured, but if you have supraspinatus pain up here, a lot of times infraspinatus has pain as well. And the function of infraspinatus for external rotation is also limited. They both share the same tendon that wraps over here underneath this acromion bone and attaches together side by side. So if one area is inflamed, most likely the bursa and the tendon of the neighbor tendon and muscle might also be inflamed as well. So that's another thing that we're going to be addressing in our video coming up. Now we're done with the anatomy, let's move on to the exercises. Now that we've identified that compression is the issue in the shoulder, we want to do something that's going to decompress that. So there's an exercise called Pendulums that we're going to do to assist with that motion. So what you want to do is put your hand on a table or something lower, let your arm dangle down, and you're just going to go in clockwise and counterclockwise directions for 30 seconds to a minute. Switch over. Now that we worked on decompressing the joint, the next thing we're going to do is we're going to stretch the supraspinatus muscle by placing your hand behind your back. And at first, you don't want to worry about how far up your back you're going to go, but initially, you're just going to place your hand right behind your back in your buttocks area, but the main thing is that you want to keep your shoulder back against the wall. the tendency is going to be to like kind of try to go as far as you can, but then that ends up rounding your shoulder out. So what you want to do is start off in this neutral position with your shoulder back, take your hand, and then just gently slide it as far as you can go and maintain your shoulder going back against the wall. And you want to hold that stretch for 30 seconds to even up to a minute, minute and a half. And that's going to help stretch your supraspinatus muscle, which is the most commonly injured right up top here. So for our first rotator cuff strengthening exercise we're going to do is called the 6-way shoulder isometrics. And what you're going to do is you're going to get a folded towel, place it against the doorway, and we're going to first start off by doing supraspinatus. So that's going to be the motion where we're going to rotate outward. So what you want to do is place that towel against the wall, and then you're going to press your arm outward like so, but you're not going to actually move anywhere because you're isolated against the wall. So just going to press out, and you want to hold it for 3 seconds and then relax. And you can do that for about 8 reps. And then once that becomes easy, you can increase the repetitions to about 15. Once that becomes too easy, you want to increase the hold time to 5 seconds. And then you're going to start back about 10 repetitions for 5-second hold, work your way up to 12, 13, 14, and then get to 15. And then once you've got to 15, 5-second hold, and it's easy, pain-free, then we're going to move on to a more advanced exercise with the band. And we're going to do all 6 directions with the band. So right there is going to be your first motion, which is abduction out to the side. The next we're going to do is external rotation. So that's going to be that infraspinatus muscle I mentioned earlier that rotates externally. So with that one, you also place it against the wall. This time your fist is going to be against it, and what you're going to do is going to be rotating out this way. And again, you're not going to have any motion, but that's the direction you're going to be rotating. So that one, you're going to rotate outward, holding it for 3 to 5 seconds. Now we're going to do the opposite direction. So this is going to be internal rotation, which is going to work your subscapularis muscle, which is a much stronger and bigger rotator cuff muscle, the biggest out of the 4. So on that one, you're just going to do the opposite. You're going to rotate inwards, like you're going to go towards your stomach. So you rotate that. Same thing, 3 to 5 second hold. The next motion we're going to do is flexion. So that's like if you're going to be pulling your arm forward, like so. But the way that we're going to achieve that is we're going to make a fist, put this towel roll on the wall in the doorway, and you're going to push forward and hold it for 3 to 5 seconds. And that's going to be 10 reps to 15 reps, pushing forward. Now we're going to do the opposite motion. So that's going to be extension. That's going to pull your arm back. So what you want to do is make your arm in a 90-degree angle, which is going to decrease the lever arm and decrease the torque. And you're just going to push back against the wall. And you hold that for 3 to 5 seconds for 10 to 15 reps. And the last motion that we're going to do is adduction. So that's going to be pulling in towards you. So you're just going to get a towel roll it up even thicker than you had it on the wall, and you're just going to bring your elbow to your side and pinch and squeeze. And same thing, 3 to 5 second hold, 10 to 15 reps. And that completes all 6 directions. So this next exercise is called Scapular Retractions. We want to strengthen the scapula and the surrounding muscles. So the way we do that is we're going to bring our elbows to 90 degrees, and you're going to bring your shoulders back, pinch your shoulder blades together. You're going to hold it for 5 seconds, and you're going to do that for 10 repetitions, and then come back forward. Back, pinch together, and forward. When you have a supraspinatus injury, whenever you try to elevate your arm, that rotation is limited. So what happens is the upper trap muscle starts to function in elevation as well to try to get you to rotate that arm. So you'll see a lot of times when people have a rotator cuff injury, when they raise their arm, it's like they raise it, but they hike up the shoulder. So you get this elevation of this upper trap and tightness. So what you want to do to stretch that muscle is grab a hold of the bench or a chair. You're going to side bend your head away, rotate towards that shoulder, and then you're gonna flex it forward. So it's a combination of the three in order to get the fibers just right for you. And return back to neutral. And you want to do that stretch for 30 seconds, 1 to 2 sets, depending on how tight your neck is. Another area that you can get tension and tightness in is in between the shoulder blades. So earlier we worked on the scapular retractions to strengthen. Now we want to stretch those muscles in the back, the rhomboids, and the middle trap. So what you want to do is you want to rotate your forearm and arm upward like this. Grab at the elbow, you're going to pull across your shoulder, pull across your chest, and you want to hold this stretch for 30 seconds. If you don't feel as much of a stretch in between your shoulder blade, what you want to do is you're going to hike your rib out like so. Kind of hunch it out, and then you're going to feel a little bit more in between the shoulder blade and the spine itself. So that's a posterior capsule stretch, rhomboid stretch, middle trap stretch, and you want to do that one for 30 seconds. This next exercise is called doorway pec stretch. You want to place your shoulders at 90 degrees, 1 foot forward. You're going to hold this stretch for 30 seconds to a minute, depending on how tight you are. Be careful with this one. A lot of times with rotator cuff impingement, external rotation is limited. So sometimes you might have to do it with just one arm by itself to protect that shoulder. So get onto the wall, and then you're going to rotate carefully until you feel a stretch in the chest here. You also want to do this pain-free, so just go to where you can tolerate it and then back off. So this one's going to be 30-second stretch. And if you can't tolerate 90 degrees, you can also come down a little bit to see if that decreases the compression in the shoulder. So earlier we worked on shoulder 6-way isometrics. Once we're going to progress past that one, we're going to do what's called a shoulder 6-way, but we're going to use a band. So first things first, we're going to do the supraspinatus muscle, which is going to be directly out to the side. We're just going to go partial motion. We don't need to go all the way up. Remember, we just need that initial rotation of the head of that humerus. So we're just going to come out and do 10 repetitions, pain-free. And that's going to be the supraspinatus muscle. Next, we're going to do the opposite direction. I'm going to switch hands here, but we're going to do adduction. So with that one, we're going to be coming inward. So step out to the side and keep your elbow straight. Come across your body. And again, if it's your left arm, then just do it this way. But for demonstration purposes, I'm going to switch arms. So elbow straight, come across body. Next, you're going to do flexion. So turn, and you're going to bring your arm straight forward. So that's flexion. Now we're going to do extension, the fourth direction. So here, and just straight back. The last two directions are going to be internal and external rotation. So what you want to do is place the towel roll underneath your elbow, and you're going to grab your band, and the motion you're going to do is rotation towards your stomach. So this is internal rotation. That's going to work your subscapularis muscle, that really strong one. And then the opposite direction is going to be external rotation. So I'm just going to switch arms here, and what you're going to do is you're just going to rotate outward. Come in towards your stomach, rotate outward. Earlier we did an exercise called scapular retraction, so this is going to progress onto a row with band. So what you want to do is you want to put 1 foot forward and 1 foot back for stability, arms forward, and you're just going to pull back, elbows back, pinch your shoulder blades together, hold it for 2 seconds, and then come forward. So you want to do this one here for 10 to 20 repetitions with a 2-second hold. So for rotator cuff impingement syndrome, what you want to do is address the inflammation. So get yourself a cold pack, place it on the shoulder where you feel it's tender, and you want to have that there for 10 to 15 minutes. And you can do that 3 to 5 times a day for inflammation as needed for pain. So that concludes our video today on rotator cuff impingement syndrome and shoulder pain. We're going to be moving on to a second video that is going to work on more complex motions and strength activities for the shoulder, so stay tuned. Today was just more to kind of ease the shoulder pain and get the inflammation down, get some general mobility and strength in there, and flexibility as well in the neck and shoulder. And next time we're going to progress on to some more stability and strengthening exercises, so stay tuned. Thank you so much for joining in today. So stay tuned and get strong with the Mechanic Shop.